Hi, I'm Duncan Thomas from the University of Southern California. I'd like to introduce you to my paper in the current issue of Epidemiology on the use of causal inference approaches to evaluate the effect of screening on cancer incidence. Some of the broader issues are also addressed in the accompanying commentary on precision prevention. The main goal of this paper was to ask whether or not there was a compelling advantage to individualizing screening recommendations based on personal risk factors. As an example, I focused on colonoscopy for detection of adenomas, which is already well known to be protective against subsequent colorectal cancer. The USPS task force currently recommends that everyone have a first exam at age 50 and then every 5 or 10 years thereafter, depending upon the outcome of previous exams. In light of the relatively large gradient in risk on both genetic and modifiable environmental risk factors, one might ask whether this schedule should be modified to reflect individuals' personal risk, a question that we'd previously investigated for genetic risks in relation to the first exam. In this paper, I described an approach using propensity scores to take account of confounding in observational studies by individual time-varying determinants of screening behavior, which can act as both confounders and intermediate variables in a causal pathway. I show by simulation that such analyses can produce stronger estimates of the benefit of screening, and applied the methods to a large case control study. I then compared various counterfactual screening policies in terms of cancer incidence, true and false positives, and the numbers needed to screen to prevent one cancer. While it looks like customization indeed does seem to be somewhat more efficient in terms of these metrics, the costs and other issues may make it not worth the effort, at least based on our current ability to distinguish individuals' risks. There clearly remains a lot to be done, notably to address the ultimate effect of screening on mortality and to take into account the other costs and benefits, work that's currently underway by a number of other groups.